Education points. How to manage nausea and vomiting during outpatient ketamine infusions. Importance of outpatient ketamine infusions after ketamine coma. Role of having children after ketamine coma.
So today is June 20th, 2011. You're here for the 3-day ketamine treatment. Let's give a little history here on you.
Okay.
I first evaluated you way back in 2002. If you really think, that's like almost a decade ago, okay? And to make a long story short, this whole problem started with that left lower extremity from what seemed to be a minor little fracture down there, okay?
Yeah.
And then it spread from there on up into your left upper extremity, okay? And then you started getting symptoms elsewhere on your body, not just there, okay? In those areas. And we did sympathetic blocks and trying to get control of this, but over time, the blocks became less effective. And it was at that time the ketamine study opened up in Germany, and you participated in that through Dr. Schwartzman. You came back, and for about roughly 6-8 months, you had roughly maybe 6 boosters running for about 2 days each with Dr. Schwartzman, and they seemed to help you, right?
Yes.
And you went all this time without any more boosters, which is quite significant, which is a little unusual. Sometimes patients will come back more frequently. But I think talking to you, to correct me if I'm wrong, the reason you didn't have boosters is you're just that, well, you just kind of, what?
I was not paying attention like I should have been.
Yeah.
Honestly, I was explaining away a lot of things
Yeah.
that I shouldn't have been, thinking it was maybe just some, I know I'd read that there would always be some residual pain from having the sympathectomy in the left leg, things like that. And I think I wasn't just ready to deal with it again.
Right. However, I think it was about 4 or 5 months ago, you really kicked into high gear with your pain, right?
Yeah.
And
it
so,
started spreading.
right. So I evaluated you, and we thought, and I know that you need a ketamine, a good solid high dose ketamine. And I think we're going to help you a lot, going through a 3-day treatment on that. Okay, well, let me just ask you one before we get into your testing your function here. You've been through a lot, Elizabeth. My gosh, you know what I mean? All the way to Germany and all that.
Yeah.
Now, tell us, do you really feel it was worth it? I mean, given all that you've been through?
Absolutely. I would do it again in a heartbeat. My pain had gotten to the point where, I was really very immobilized by it. And, I have no doubt in my mind that had it gone on much longer, I would have ended up in a wheelchair. I wouldn't have been able to move around. And I knew I was at a bad place. And I kind of feel like if I hadn't gotten that treatment at that time, I don't know that it would have worked waiting much longer.
Right.
It was,
right. And
it was
without
really getting out of control.
Right, right. And without going any details at all, you've had a lot of things on your plate, a couple of kids, and a lot of things on your plate, right?
Yep.
So you have every reason to be one of those people that's totally stressed out with a lot of stuff on your plate.
Yes.
Is that accurate?
Absolutely. An unnatural amount of stress that I hope to not have to go through again ever in life.
Exactly,
Yes.
exactly. Okay, now let's go through some exercises for you, okay?
Okay.
And by the way, the stress isn't related, it's all personal related. It's nothing to do with the ketamine, with the RSD. It has to do with other personal things that have been going on.
Yeah.
So let's do this. Let's look straight ahead. And I want you to do the vertical finger test. Probably your right hand is the better one to use.
Yeah.
2 vertical fingers in your mouth, please. And are you having any pain when you do that?
No.
Okay, good job. Next thing I want you to do is take that right hand, put it behind your head, please.
Okay.
Are you having any pain when you do that? Okay, very good. Now I want you to do as best you can with the left. Take your right hand down. Do as best you can, but I don't want you torturing yourself, okay? Go ahead, see what you can do.
Okay.
Don't torture yourself. Just get it as best you can, okay?
All right. Okay.
Okay, I got you. We got it. Okay. Next I want you to do is take that right hand out in front of you, and I want you to open and close it using your thumb as best. There you go. Good job. Now do the same with your left, please. Open and close it as best you can. Okay, good girl. Good, excellent. Okay, good job. Now, next thing, Elizabeth, we're going to ask you to do here is we're going to go and focus on your lower extremity, okay? And starting with your right, take your foot off the ground and rotate your ankle as best you can. Good job. Wiggle your toes, please. Okay? And go ahead and hitchhike back to the east coast of Florida. There you go. You got it. Now on the other side, rotate your ankle. This is your worst side, so do the best you can. Rotate it. Hardly any movement there at all, right?
Yeah.
Wiggle your toes as best you can. Okay. All right. Hitchhike on back. Home. Oh, very good. Now, the next thing we did, and we got Tabitha's here to help us out a little bit, okay? I want you to go and stand by the door there, please. Atta girl. Good job. There you go. Now, what I want you to do here, Elizabeth, I want you to walk toward me at 3 steps and 3 steps back, please. Atta girl. You got quite a limp there, don't you?
Yep.
And go on back, please. Very, very good. Yeah, all right. And that's something new, Elizabeth, because I know I saw you a few months ago and you didn't have a limp. In fact, you were more or less a ballerina, weren't you?
Yeah.
Walking around on your toes.
Yeah, it's gotten bad again pretty fast.
Right. Now, if you can remember, when you took those 3 steps, did we trigger pain when you did that?
Mm-hmm.
Okay. Where did you feel the pain? Tabby, go on that side and point it out, because she can't bend over very well. Tell her where the pain was.
It's all up and starting through the toes, up through the foot, and going up the left side of the ankle, all the way up the leg, and then going up into the back.
Okay.
And the side of the leg, up through the hip, all the way up to the hip. And
Okay. Very good. Good job. Okay, and the next thing we're going to have you do here, now Tabby, get on her better side, her right side. And I want you to hold Tabby's hand, okay?
Okay.
All right. Now, what I want you to do here, Elizabeth, again, I'm not here to, cause you a lot of pain, but do the best you can. See if you can take a step at all on your toes, 3 steps forward. If you can't, you can't, okay?
I couldn't do it with the left side.
Okay, you can't put weight on that left side.
No, I can't.
No, that's fine. That's what we need to know. We need to know that, okay? Next thing I'm going to ask you to do is to see if you can take 3 steps on your heels, please. And if you can't do it, you can't do it. I don't want you falling and hurting yourself. Okay, you can't do it. Okay, that's good enough. Oh, one more thing, just for completeness, okay? See that black stretcher over there?
Yeah.
Okay, I want you to leap from where you are onto that. Can you do that?
Yeah. I don't think so.
Not today?
No.
Well, this is when we get done with you. I expect you to do that. You got
I
that?
hope so. I need the super mom cape back on.
Okay, have a seat, please.
Okay.
All right.
Okay.
There you go. Thanks, Tabby. Okay, now, this is the part where if you have any questions, I know you're pretty well stretched you out a little bit here. Any questions at all? Anything at all? Any would you like to ask right now?
No, honestly, I'm just relieved to be back over here and,
Okay.
and getting treatment done.
Yeah, now your brother's going to be by your bedside during
Yes.
infusion. Elizabeth?
Yeah.
Listen, Matthew's got a couple of questions for you, okay?
Okay.
You're on 200 milligrams an hour, okay? 200 milligrams an hour of ketamine, and this is your last day, your 3rd day. Do you understand? Mm-hmm. And we want to document how you can answer questions now. So go ahead, Matthew. All right.
Elizabeth, what is your daughter's name?
What?
What is your daughter's name?
Do you know your daughter's name, Elizabeth? Elizabeth.
My jar.
That's right. You're doing good. You're doing good. Keep going. Yes. What's your daughter's name?
Sophie.
That's right.
That's right. Very
Yeah.
good. Congratulations. Ask her another one of those
All right.
questions.
Elizabeth, what is your sister's name?
What?
What is your sister's name?
Thea.
Yes, that's right.
Very good. Very
Good
good.
job.
Now, this is Dr. Kirkpatrick. Can I ask you a question?
Yes.
Okay. I noticed that your brother, Matt, he has a patch on his shirt, okay? Can I ask you a question?
Yes.
What did I notice about Matt?
What?
Okay.
That is a hard question.
Well, you think you can answer it? Maybe you can't
Poor
answer.
thing. She's so adorable.
Okay. Okay, can I ask you another question, okay?
Yes.
I noticed that Matt is wearing a blue shirt, okay?
Okay.
Can I ask you a question?
Yes.
What did I notice about Matt? Do you know the answer?
What?
What did I notice about Matt? That's my question. What did I notice about him? Listen, you're doing just great.
Okay.
Okay. Now, one more thing I want you to do is I want you to open your eyes up here. Look up here. Look up here. Atta girl. Good job. A little higher. Very good. A little higher up here. Now look over at Matt. Look over at Matt over here. Good looking guy, huh?
Yeah.
Yeah. All right.